Newborns are born to cry, but if your baby's crying jags are increasing and it seems like nothing you can do will bring comfort, it could be colic.
If you look at the medical literature, some people define it as crying for more than 3 hours a day. That happens more than 3 times a week and in a kid less than 3 months old.
She just cries all the time.
All the time since how long have you noticed that for?
A few weeks.
So it changed since she was born. She knows she's crying more now?
Yeah.
Pediatrician Ahmed Beloni of Children's Physicians Medical Group says colic is a common concern among parents of newborns.
In general, colic is just persistent crying. So you feed well and then still cries. You change the diaper and then still cries. You really try a lot of different things and there's just crying that persists.
You know, it looks like her exam's pretty normal, okay, which is good news. Unfortunately, it looks like what she's going through is a little bit of colic.
These periods of crankiness may seem like torture, but Dr. Beloni says there are ways to calm your baby and your nerves.
Have you noticed anything that helps her calm down when she's crying?
Actually, we take her on walks outside, and she seems to like that.
There's actually a lot of things that you can try as a parent. Car ride makes their baby feel better, or you take them for a walk in the park using a stroller. Other things you can do are swaddling. You know, when babies are swaddled and wrapped up nice and tight so they're not flailing their arms and legs away, they tend to feel better. Sometimes changing dietary things, so if you're a mother that's breastfeeding, avoiding those more allergic foods like milk, dairy products in general, peanuts and eggs can help. Or if you're giving formula, you might want to talk to your pediatrician about changing the formula.
Posture changes such as curled up legs, clenched fists, and tensed abdominal muscles are common during colic episodes. But how can you tell if something else is the cause of your baby's discomfort?
If there's all of a sudden bloody stools along with the crying, that's something we take more seriously. If there's a lot of spitting up or throwing up, especially if that spit up has different colors in it, like green, yellow, or red, that's something I would want to know as a pediatrician.
Colic can be distressing for both you and your baby, but take comfort. It will pass.
It's just something the baby's going through, and there is actually a light at the end of the tunnel. Usually by age 4 months, most colic resolves on its own.
Dr. Beloni says it's perfectly okay to give yourself a break.
Sometimes if the crying is too much, you know, you gotta give her to your husband, just give yourself a break for a little bit, because it's stressful to hear baby crying the whole time.
Actually, there's no evidence to show that a baby crying from colic has any long-term effects. So sometimes if you really reach the end of the road and you know, you've tried a lot of different things at home, then it is okay sometimes to let babies cry. Babies are gonna cry, and it doesn't always mean that something is wrong.
To learn more about colic and other children's health topics, visit cpmgsandiego.com or call 877-276-4543.